The current number of people diagnosed with diabetes in Scotland is over 200,000, which equates to about 4% of the population. Each person with diabetes should be offered foot screening annually by a trained member of staff to reduce their chance of developing foot problems. The aim of this DVD is to provide you, as a healthcare professional, with training on how to perform and record a diabetic foot screening. The rationale behind carrying out a foot screening in people with diabetes is to identify those at increased risk of developing foot ulceration and then to implement a suitable package of care to manage existing problems and try to prevent further problems. Helping people sustain and improve their health requires well-trained staff and effective information technology. As well as demonstrating the method of foot examination, this DVD shows you how to record this information using the SkyDC foot screening tool. SkyDC stands for Scottish Care Information Diabetes Collaboration. This is the national IT system to support people with diabetes across NHS Scotland. There are many advantages of using the SkyDC foot screening tool. These include the secure storage of information, the prevention of duplication of effort, the calculation of a person's risk status automatically and consistently, and the availability of treatment and referral recommendations on screen. Careful foot examination and screening is the cornerstone of good diabetic foot care, and the advice in this DVD should help you achieve this effectively.
There are two main conditions that can affect the feet due to diabetes. These are peripheral neuropathy, which affects feeling, and peripheral arterial disease, which results in reduced circulation. Diabetic peripheral neuropathy is defined as the presence of symptoms and/or signs of peripheral nerve dysfunction in people with diabetes after exclusion of other causes. One of the symptoms of neuropathy can be the loss of protective sensation in the feet. A person with loss of protective sensation could injure their foot and be completely unaware of any resulting problems. Peripheral arterial disease causes calcification, arterial narrowing and blockage of the blood vessels, which can result in reduced blood flow to the feet. This can manifest itself in many ways, and in particular it may cause pain when walking or at rest and result in a reduced ability to heal. Sit the patient on the examination couch with their shoes and socks or stockings removed. Inform them that you're going to examine their feet and carry out a diabetic foot screening to check their risk of developing any diabetic foot complications. Access the SkyDC system, select the appropriate patient record and go to the SkyDC foot screening page. The patient's details will be displayed across the top of the screen. Check that these details are correct. Enter the screening date by clicking on the button marked Today or use the calendar provided. The first section is regarding any previous amputation. Fill this in as appropriate and confirm that if the patient has suffered an amputation, that the amputation is diabetes related. The next stage of the screening process is to check the general shape of the feet for any structural abnormalities such as pes cavus, claw toes or hallux valgus, all of which could increase the patient's risk of developing foot complications. Check both feet for any areas of significant callus or dry skin, paying particular attention to the heel area. Check between the toes for problems such as athlete's foot, soft corns or fissures. Check both feet for areas of ulceration and ask the patient if they've suffered any previous ulceration. Check if the patient is able to self-care. This can be done by checking if the patient can touch their feet with ease and if they're able to see their feet clearly. If there are other risk factors present, such as nail pathologies, obesity or inappropriate footwear, this should be recorded as yes and a note placed in the text box provided. The next stage of the screening process is to check the patient's circulation to their feet. There are two pulses we look for in each foot, the dorsalis pedis and the posterior tibial. To find the dorsalis pedis pulse, palpate the top of the foot between the first and second metatarsal. Note that the dorsalis pedis is absent in about 10% of the population. And to find the posterior tibial, palpate the area behind the medial malleolus. Record whether either is present or both are absent. Ask the patient if they're experiencing intermittent claudication, which is pain or tightness in the calves when walking, relieved by stopping, and if they've had any previous vascular intervention. The next test we carry out is for diabetic neuropathy. This is to enable us to easily check if the patient's protective sensation is intact. For this test, we use a 10-gram monofilament. It's important that you only use reputable makes of monofilaments, such as those manufactured by Bailey Instruments and Owen Mumford. This will ensure that the information you are collecting is accurate. The monofilament must be rested after use and replaced regularly, approximately every 6 months. The advantages of this test are its simplicity, accuracy and low cost. Studies have shown that the inability to feel a 10-gram monofilament is a useful test as a predictor of future occurrence of diabetic foot ulcers. Inform the patient you're going to test the sensation in their feet with the monofilament. Show the patient that it's not sharp by first testing it on their forearm and then with their eyes closed as a comparison. The monofilament should be applied perpendicular to the surface of the skin and with sufficient pressure to cause a slight bend in the filament. If it's kinked, it'll need to be replaced. Test over the first and third toes and the first, third and fifth metatarsal heads as demonstrated. Avoid testing areas on the foot where there is callus present, areas of ulceration or scar tissue. You may have to test proximally or distally when any of these are present. Do not make any repetitive contact or allow the monofilament to slide across the skin. The patient should have their eyes closed and respond yes each time they feel it on their foot.
Yes. Yes. Yes.
The total time from contact to removal of the monofilament should be approximately 2 seconds in duration. The sites and timings should be randomised to prevent the patient guessing. The patient is at risk if they score less than 8 out of the total 10 sites. There are 2 other tests which can be carried out to test for signs of neuropathy. These can be carried out using a neurothesiometer or a neurotip. It's not necessary to carry out these additional tests during a routine screening, but they may be carried out as part of a more in-depth assessment and can be useful for research purposes. Ask the patient if they're experiencing any pain, paresthesia, usually described as tingling or burning in their feet, and record as appropriate. Record if the patient currently attends a podiatrist. If the patient requires to be referred to another healthcare professional, tick as appropriate. The patient's risk category is automatically created by the information recorded, and this will allow you to print off the appropriate advice leaflets required. You should then record if written and verbal foot health education has been provided. Enter any appropriate clinical comments in the text box provided and then submit the foot screening form by clicking on the button provided.
We are now going to carry out a simple diabetic foot screening on our patient in a clinical situation. Firstly, we check that there has been no previous amputations. We then check the general shape of the feet for any structural abnormalities. Check for areas of callus, paying particular attention around the heel areas. Check between the toes for any problems such as athlete's foot or fissuring. Ask the patient if there has been any previous ulceration. Check if the patient is able to self-care by being able to reach and see their feet easily. We then check the 2 pulses on either foot. Firstly, the dorsalis pedis, and then the posterior tibial. We are now ready to carry out the neurological test using the monofilament. We test the 1st and 3rd toes and the 1st, 3rd and 5th metatarsal heads, recording as appropriate.
I'm about to test the sensation in your feet using this monofilament, but first of all I'll test it on your arm so that you can see that it doesn't feel sharp. Okay? You feel that?
Yes.
And if you close your eyes, can you still feel it?
Yes.
Okay. I am now going to test the sensation in your feet, so if you'd like to close your eyes and just say yes each time you feel anything on your feet.
Okay. Yes. 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 Yes.
When you have completed the patient's screening, you will then enter the data in the Sky DC foot screening form. First of all, we check that all the patient's details are correct, then enter the screening date by clicking on the Today button. This patient did not have any amputation, so no change is required to this section. This patient had no other risk factors present, and as this section is already populated as showing no problems, no changes are required. This patient's pulses were palpable in each foot, so fill in as appropriate. This patient could feel all 10 sites when tested with the monofilament, so no change is required. There were no symptoms of painful neuropathy, so no change is required to this section either. By now, the patient's risk status will have been automatically calculated. In this case, the patient is in the low risk category of developing a foot ulcer, and no further referral is required. Record if verbal and written education have been given, and submit the form. The Sky DC system lays out the screening journey in a logical and easy to follow format throughout the screening process. When a patient returns for a subsequent screening, the previous screening details and risk status will be populated on the form. These details can be changed accordingly to represent the screening you have just carried out before submitting the form.